What is OCD?
I just wanted to pick up on your language, which is so interesting, because earlier I said, you know, we're all panicking. I'm in a panic. I mean, we overuse the language, so you're right. It used to be I'm so anal, now I'm so OCD.
Yes.
So it's misused, and I don't like that. I want to save our terminology for the right place, but, you know, things lose themselves in popular culture. But to answer your question, O and C. D stands for disorder. The O is the obsession. The C is the compulsion. A true, fully blown obsessive compulsive disorder has both. We'll talk about some things on the fringe that don't always involve both. So my obsessions are my thoughts. My compulsions are my actions. So when you see Jack Nicholson avoiding cracks on the sidewalk, I don't remember that scene exactly, but I don't remember what his obsessions were. But for example, the most common one would be, I'm obsessed about germs, I'm afraid of getting contaminated, I wash my hands. Oh, we're there. Okay. Oh my goodness. Okay. Yes.
Yeah, exactly what you mentioned.
Yes. Harming thoughts. Okay. So it's funny. I didn't see it on the screen. So if I'm obsessed about germs and contamination, I can do one of many things. I can wash my hands excessively. That's a very common compulsion that we know about. I can shower up to 6 times a day. I can do innumerable loads of laundry every single day. Just because what did I touch that might be dirty, that, you know, I can redo my same washed clothes. I'm giving you true life examples. This is not me, but these are patients that I've seen. So here's an interesting question. The ordering and arranging things in a particular precise way, you might say, well, I do that.
Yeah.
I mean, if you're a neatnik, you're a neatnik. It doesn't mean you have OCD. If you're ordering and arranging things in a particular precise way because that's going to keep you from killing your mother, then you might have OCD. Does that make sense? I'm sorry to use such an awful example.
It does make sense.
But you've got the thoughts about harming. Oh, it's not there, is it?
But
very,
that's
very common obsession. Sorry, our thoughts about harming others.
Yes, okay.
And our thoughts about doing harm to oneself, by the way, or thoughts about harm coming to me. But the obsessions and the compulsions often just don't match each other.
Right.
Like fear of germs and hand washing kind of match each other.
Right.
But you wonder, well, how is that the compulsion that person developed in order to sort of mitigate or manage the obsession? It's the brain.